Dr. Kang, a few basic questions. I think the basic question on everyone's mind is, how dangerous is this?
Well, the strain of monkeypox that is circulating around the world at the moment is one that has a relatively low case fatality rate. It is a strain that in Africa has about 3% case fatality. But when it has infected people around the world, where healthcare is in general much better, the rate has been much lower than that. It's been 5 deaths reported so far out of 16,000 plus infected individuals. And most often when deaths do occur, they tend to occur in very young children or in people who have significant immune compromising comorbidities such as HIV.
Dr. Kang, just a broader question. As a scientist, researcher, looking at this, how worried are you personally about what we see now and concerns about mutations if this spreads further?
Well, for one thing, it's a virus that is not an RNA virus, so you should not expect too many mutations to accumulate too quickly. You cannot relate this to what we have seen with SARS-CoV-2. Nonetheless, it is a public health concern because prior to this, the outbreaks were relatively limited and many of them were traced back to an animal to human spread. What we are seeing now is clearly human to human spread, and that's why we should worry and put in place public health measures. But this is not a virus where, even though it spreads through the respiratory route, most often the respiratory spread happens when people are symptomatic. So if we are aware of symptoms, if we track travel histories, if we track contacts of people who are known to be infected, make sure that they are isolated, or when and if we have vaccines, provide a ring vaccination strategy, I think we should be all right. It's something to be watchful about, not something to be scared of.